Everyone, thank you so much for joining us this evening. We invite you all to take your seats when you're ready. We are so happy to have you here at our September Forefront series. My name is Jennifer Sharp Potter. I am the Senior Vice President for Research at UT Health San Antonio. Tonight is a truly special Forefront. We're excited to showcase a program called Caring for the Caregiver, presented with Dr. Roxana Delgado and Dr. Fayron Epps. We also have a special guest tonight who is a participant in a very important program called Caring for the Caregiver, Mrs. Mabel Goldsmith, and she'll be joining us in a little bit. Few of us really think, when you think about caregiving, you often focus on the individual who is being cared for. And often we don't even think about caregiving or the person who is providing the care until someone in our family needs that. Often, if you think about it, it might be for someone who is aging, who might need assistance, or somebody, unfortunately, who might have cancer or some other significant health condition. And if you've been that person, or you know someone who's provided care as a caregiver, that probably resonates with you. And elevating those individuals and having them be seen is so incredibly important. And that's what we're here to do tonight, and learn a little bit more about what UT Health is doing. You may not know, but there are an estimated 53 million caregivers, family caregivers in the United States, according to a report from the AARP and the National Alliance for Caregiving. This includes individuals providing care to a family member, and even more than that, a friend or another loved one with an illness or a disability or aging-related needs. And often, you don't prepare to be a caregiver like you might prepare to raise a child. It's something that comes upon you. And so how do we make that, and how do we optimize this so we can really make sure that both the individual being cared for and the caregiver are seen and heard and valued in that? The Caring for the Caregiver program provides services and resources designed to support individuals through their caregiving journey. It acknowledges the challenges that often accompany caregiving. And our team of healthcare professionals, I'll give a shout out to the School of Nursing when I say this, is committed to offering compassionate support to those who selflessly care for loved ones and friends. So you're going to hear from these two extraordinary scientists, and I'm going to mention and introduce them to you now, and then I'll ask them to join me on the stage. Dr. Roxana Delgado is a health scientist and epidemiologist specializing in military and veteran communities. She serves as a professor, military research scholar, and director of Caring for the Caregiver program at the School of Nursing. Additionally, she's a VA-affiliated scientist and a key investigator with the Veterans Affairs Elizabeth Dole Center of Excellence for Veteran and Caregiver Research. This is, and I'm sure you'll hear about it, a very prestigious focus on what it means to be a caregiver and how to elevate that for our military veterans. Dr. Delgado's research centers on identifying the predictors and health outcomes in military caregivers, with a focus on long-term course of disease and illness. For example, in one of her recent studies, it explored distress phenotypes, we're going to ask her what phenotypes are, as predictors of suicidal ideation in military and veteran caregivers. That's right, suicidal ideation in caregivers, and why that might be and what we can do about it. And then Dr. Fayron Epps. She's a professor in the School of Nursing and holds the Karen and Ronald Herman Distinguished Chair in Caregiver Research. Her research focuses on evidence-based practices aimed at enhancing the quality of life for individuals with dementia and their family caregivers. Dr. Epps is also the founder of Alter, the only nurse-led, dementia-friendly congregation program. And again, we'll find out more about that. And for both of these folks, I had an opportunity, just on a personal note, to meet them when they were first joining UT Health at different times. Dr. Epps, perhaps most recently. And one of the things that was so exciting to say is how special our community is, and that this is the type of work that we see every bit as important as the other work that we do. And it's just an honor to have them both come to the stage. So I hope you give them a round of applause. Oh, I like this. We've timed it.
That's what he told me.
Okay. So again, thank you so much for being here. We really appreciate it.
Thank you.
It's exciting to share your stories and what you do. I'm interested, just to get us started, what is your story? How did you get interested in this work? And I think Dr. Epps will start with you, and we'll go to you, Dr. Delgado.
Yeah, I got interested in this work in my PhD program, so when I was getting my doctorate, so this was over 10 years ago. Family caregiving has always been really strong in my family, but what I noticed is on my maternal side, it was a joy to provide care for my grandmother. I mean, we would do anything, drop everything. But on my paternal side, it was a struggle, it was a stress. When I went to go visit my uncle during college, on college breaks, he actually had my grandmother tied to the bed. Two different sides, and that made me want to, what's really going on here? And so for my PhD program, I studied how religiosity plays a role, family obligation, and looked at it among African Americans, Latinx, and white families. And so that's where it all started. And I was able to see the similarities and the differences. And I really got into dementia caregiving when I started my postdoc. I was like, I just want to help family caregivers around the world. And for my postdoc, they said, no, family, that's a lot, that's very broad. And I was like, well, and they say you have to find, they recommended me to find one chronic illness to really focus on. And just so happened, the Alzheimer's Association had put out their facts and figures. It was in the spring. And I picked it up and I was like, dementia in the Black community? Dementia in the Latinx community? Like it didn't make sense. And I was a nurse and I had never taken care of a patient, a Black patient that had a diagnosis of dementia. And I didn't have it in my family at that time because I didn't know honestly what dementia and Alzheimer's disease was. I didn't. And that allowed me to really go and look into it some more, and that's when I focused. I said, you know what, I want to raise awareness. I want to see how can I support these families that are on their journey. And what I found out, I'm originally from New Orleans, and that's where my research started. And what I found out was when I went to go meet these families, because I want to find these families, especially a lot of the Black families that they say that we're twice more likely. And when I put the call out there and I started looking for families, I was so shocked. These families were my friends, my coworkers, people I was with every day. And they just never discussed that they were on this caregiving journey and supporting someone living with dementia. But once I shared with them what I was trying to do, they opened up and I learned about all the different unique challenges and their experiences that they were going through. And that's how it all started. And I am here. I am excited to be here in San Antonio. I moved from Atlanta, Georgia this summer. And so many people's like, you left Atlanta to come to San Antonio? Yes, I did.
Wait a minute there.
I'm happy about it, but I would share with you all, I get this question a lot. Well, why did you come to San Antonio? You know, you had this great program of research going on in Atlanta, and my program really reaches beyond Georgia. It's across the nation, and you chose San Antonio. And I will tell you all, when I was coming to just visit here, I ran across members of the community that needed, I felt they needed my help. They actually said it. I spoke at a church and that was last October. I went to a church on a Sunday out here and I was telling them about dementia and caregiving, and they met with me afterwards in their multi-purpose center and they said, oh my God, we didn't even know this. And I was like, but they have a great program at UT Health. And I think what I realized, there's still pockets of communities that are unaware and they feel that they're being overlooked. And I want to come here and change that and also highlight the great things that UT Health has in the School of Nursing and the Caring for the Caregiver program. And just Texas alone, I know you gave your statistic on how many family caregivers across the country, but in Texas alone, there's a little bit over 1 million dementia caregivers. So these are caregivers that are caring for someone living with dementia. And I know Texas is a big state, I get it, I'm learning, it's about like 4 states in one state. I was like, but still to me, that's a significant number, you know, and I'm hoping to drill down to see how we can help those in San Antonio and in the surrounding areas, and then we can be that an example for the entire state so we can help out the family caregivers, especially those that are on this dementia journey. So hopefully I answered your question.
I think you got more and
Oh,
more.
okay.
I'll just, as you might have already picked up when we met, and Dean Harden, the Dean of the School of Nursing, is in the audience watching today, but I met you, and she knew more about San Antonio than I did. She was looking everywhere and really was very intentional about the choice, and it was just fascinating, and that was part of the moment I knew, gosh, we need her in San Antonio, just with what you're doing and everything. So we're very grateful for your choice.
Thank you. I'm glad to be here. And one of the things I want to let you all know, you may often hear me speak in other platforms, but I introduce myself as a community engaged researcher. So community is really, really important to me. And before I made that decision to come here, I made multiple trips and I embedded myself in the community. So I can hear from them, I can learn from them, I can see what is their journey. So my research can actually respond to their needs. And I really speak to that because I don't want to be the one that says, oh, I have this great idea, this is what the literature says is going to help. No, I really want to hear from the caregivers so I can respond and create these programs that can reduce their stress, reduce this burden, to just better quality of life while they're on this journey.
So speaking of the voice of the community and having community engaged work, it's important to have the voice. I'm curious, that's a good transition to you, Dr. Delgado, about how this started for you, what you did. Your story is incredible.
So for me, it also started very personal. I was working with research with veterans with PTSD and TBI, traumatic brain injury, and post-traumatic stress disorder. And we have seen how the landscape of the nation has changed in the past 20 years with wars in Iraq and Afghanistan. I was a military spouse at the moment, and 3 deployments. My husband had 3 deployments, and on his last deployment, he was wounded. And that took me to Walter Reed, that took me to different facilities. I spent many countless hours in different waiting rooms, hospitals, Fisher House. I lived in a Fisher House for 5 weeks. I actually loved it. They have the best accommodations. So that really took me to another environment that I was not aware of. And that was being the caregiver of a wounded, ill, and injured veteran. At that time, my husband was, medically evacuated in June 29, 2009. And actually, he was evacuated 15 years ago, a day almost like today. It was last week. He's 15 years ago. And I remember him coming home and of course, having to go through a lot of rehab and everything that I had to step into that role. And at that time, I was in my first year of my PhD program. And I remember people telling me, wow, how are you going to be able to do full-time job, full-time school, and being able to do everything with the caregiving? I became his full-time caregiver at that time. So I remember thinking to myself, Roxana, you could do 2 things. You can drop your school and just take care of Victor, or you can press on, get the PhD, and make a difference. And that's exactly what I did. I continued my PhD at the same time that I was caring for my husband. But at the same time, I started learning so much from the community. Like Dr. Epps was saying, there's nothing like being a researcher that is part of the community, where you get to learn very much what are their challenges and their barriers. Not the challenges and barriers that are in a journal or that are in a book, but those are the true lived experiences that people are going through. What are those different things that they need to be equipped with, right? And in our community of military and veteran caregivers, they're very young. They're 28 years old, 30 years old. They still have a very long, trajectory and journey in front of them, decades. And this is not the first time. I remember spending some time in Walter Reed, and I started reflecting a lot. And I said, why we don't know anything about caregiving from World War II and Vietnam and Korea and all these different wars? Why? Because we never really put a lot of attention into it. But I met World War II and Korea and Vietnam caregivers of amputees and burns and all kind of different catastrophic injuries. And I remember I vowed to myself, I said, when I finish my PhD, I want to dedicate my entire career to look at the health and well-being of caregivers and being able to establish and implement programs that can attend to not only their needs, but that can bring the community together. that they can find that voice, that they can have community, because isolation is one of the huge topics in the caregiving community. So I don't know if I answered your question, but that's what brought.
Isn't that amazing?
That's what interested me, and how I ended up in UT Health. I love this story because I came to do a lecture in San Antonio. I was in El Paso, Texas. My husband was just retiring from the military at Fort Bliss, and we thought that was it. We're retiring here, and we have it all collective and put together. And then I came to do a lecture, and I finished the lecture saying something like, as researchers, we always think about numbers, but sometimes we don't put names into the numbers, of course, and we don't think that these are people. And I finished the lecture there were like over 100 researchers, a lot of the UT Health faculty members. Dr. Hepburn was there. And I remember I said, these numbers have a name, and those names have a family member. And I shared a little bit of my story and said, as I'm standing here in front of you talking about chronic diseases and chronic pain and suicidality in veterans, at that time I was doing that topic, I said, we have to think about the family members. That may be they don't have a voice, and they may be at home, silent, suffering through all this. So as researchers, we have to do a better job and reach out and understand better the family unit. And someone from UT Health reached out to me, and she said, if you could do anything, what would you do? And I said, I would love to work on caregiving research. I would love to shift my entire career to just focus on the caregivers, on those family members and friends that are caring for our nation's, heroes. And a week later, I got a call, and I was the inaugural fellow at UT Health, the Military Health Institute. And the reason why I chose to come here is because we're in Military City, USA. We know that we have the best care for veterans in the nation. And we can say that. I have seen the statistics. I have sat with many generals and people, and we can say that San Antonio has the best medicine that you can think of for the veteran community. And there's a catchment area here. This is where the caregivers are. This is where we can make a difference at a nationwide and be an example for the rest. And we are doing that. We're actually doing that. And by coming here, UT Health afforded me all the opportunities and all the resources to be able to do caregiving research. And I'm very grateful, because then Dean Harding last year, she's like, hey, we need you. and Dr. Song, and then I transitioned to the School of Nursing, and that's how, and then they appointed me as the Director for Caring for the Caregiver Program. So as you can see, this has not been an easy trajectory in a journey, but I would do it all over again. Why? Because when you're given blessings of being able to overcome barriers and challenges and being able to see the light of hope, then I cannot just keep it to myself. I need to look behind me, over my shoulder, and take care of those behind me. So thank you so much I think I answered your question and more, right?
I think you both did an amazing job. Thank you. So, one of the things that I think is so fascinating is peeling back the curtain on research that we do at UT Health and really looking more about it. So how do you, and I'll start with you, Dr. Epps, how does your research shine a light on caregiving? If you could just break it down a little bit to what that is.
Yeah, so my particular research, one arm of my research is developing and testing caregiver psychoeducation programs. And so many times that a caregiver, especially those that are caring for someone with dementia, they're just thrown into this, have no skill set, no one prepared them to do this. And so with my programs, we're trying to increase their mastery skills, their competence in their skills. And if we find that if they feel more confident in the skills, it helps out with their emotional well-being. And then in return, we call it a secondary outcome, but that person living with dementia will exhibit less behaviors, less of those challenging behaviors that's associated with dementia. And so a lot of my work is with psychoeducation programs. So that's that one arm. Mm-hmm. And then the other arm is creating these dementia-friendly congregations. So I am a woman of faith. And in the communities I work with, when I started doing my research early on, at first, me being a woman of faith, and that's really important to me and my family, a lot of my mentors were saying, you can't do that. nah, that's not going to get you any money. No one's going to care about that. But every time I kept doing my research and meeting with families, it kept coming up. Their church, their pastor, their faith has kept them on this journey. And so when I started meeting with the leaders, that they didn't know, faith leaders, they didn't know anything about dementia. And then I had that one family was sitting at the kitchen table and she was in tears because the bus stopped coming to get her mom. Her brother stopped bringing her mom to church because he was embarrassed. People were going to start talking about him. And she said, I just want them, church is so important for my mom, and I just want her to be able to attend. And so that's when I took on this journey, or this task, is to work with faith communities to implement a framework so they can become dementia friendly. And so not just the person living with dementia can come back to the church, but also that family, the family caregivers. They can come back and have worship, but then also engage in all the other activities that church holds, because it's more than just worship. I mean, this is truly a community, and I want to make sure that our communities are equipped now to support their families and the parishioners.
Yeah, and Dr. Ebb, something you said, I just want to pick up on the business of research and science that you mentioned was often mentors with the best of intent or other people will share you can't get money for that. And I'm just going to highlight what that means is most research at universities like ours is funded by extramural sources. So that could be the National Institute of Health, it could be the Alzheimer's Foundation, it could be philanthropic dollars, and you'll hear a little bit about that in a minute. But what we do is those requirements are there, and sometimes it can dictate in some ways the opportunity, particularly with new cutting edge areas, because they don't see a path. You can't get money for that. So it's an interesting point about science is that we have to have brave people at the forefront of what they're doing to really push the envelope and expand our understanding of science and innovation and learn that we can do these things. How about for you? Is it the same with the military veterans and their caregivers that actually caring for the caregiver also has those collateral benefits for the individual?
Absolutely. And the thing is that for the military caregivers, because we didn't fall within that threshold of the age of caregivers in the nation, we didn't know too much about it. So now we have a 28-year-old being a caregiver, but they also have kids, and they became sandwich caregivers in the middle of in no time, right? It's like a switch. So what we see in the military and veteran caregiver in 2014 is when we received the first really population study that showed the depression, 4 times higher than any other group in the nation, 5.5 million caregivers in the nation, and actually as last week I received word that in San Antonio alone, in the Alamo region, we have close to 100,000 caregivers. Of course, we're Military City, USA, so military and veteran caregivers. So one of the things that I remember, I was in this room with the VA, and they were talking about suicide of veterans. And Senator Dole, I'm also an Elizabeth Dole Foundation Fellow, and we do advocacy across the nation to change legislation like the RACE Act. And she stood up in this room and she said, of legislators, and she said, caregiver suicidal ideation it's the elephant in the room nobody's talking about. And there were a couple congressmen and senators that said, but show us the numbers. Unfortunately, we didn't have numbers. There was no data on suicidality. And that kind of sparked my, and in 2017, through UT Health, we were able to do the seminal work, the first epidemiological study looking at suicidality and phenotypes. What it means is...
Thank you. I'm just going to get to that.
Phenotypes is just cluster of how they look. So out of a sample of almost 500 caregivers, we're able to look at 3 distinct similarities, right? Low, medium risk, for suicidality. So when we're thinking about creating programs or treatment plans and different things, we need to look at those high risks, right, for suicidality, and caring for a veteran with TBI, PTSD will bring all that. So the other beauty thing of UT Health is that as soon as the study was done, we package it in a report, we send it to the Coins Veteran Network and some others, but UT Health also established the first national telehealth to address the mental health of caregivers. And I remember I was so excited about it, and it made national news. And then the study was picked up by AARP, and when AARP put this study in their newsletter and everything, I started getting a lot of calls from caregivers saying, hey, I thought I was alone. I thought I was the only one. So that's one of the areas that was so critical to look at the moment, but what we're looking at is the trajectory, right? It's very unique because when you have military and veteran caregivers, they more likely have 3-4 more decades to go. So I wanna make sure that we're ready as they're aging, that we're able to identify those patterns and that trajectory of health to be able to do prevention. And that's what we need to do because we need the caregivers to be strong and healthy to be able to care for the veteran. So,
Thank you, and I'm going to ask you in a minute about caring for the caregivers, but before I do, I just have a question for you. So now that you're here in San Antonio, you have this national platform, and I see you sometimes on social media, so I can see that very much. But I'm curious, what is your next step here in San Antonio? What do you see? Are you interacting with the Alzheimer's Institute, the Biggs Alzheimer's Institute, or what do you see on the roadmap for you for your next project?
Well, I think it's me continuing to learn the community and expand the work that I started in Georgia, and a lot of my work on national platform is still primarily Southeast, Midwest, a little bit in the Southwest and a little bit on the West Coast. So I see bringing those programs over here and adapting them to the community. And so I am working closely with the Biggs Institute for their outreach and recruitment education core. Then also working with the Alzheimer's Association. And so working with them really closely to see what are those things that we can do and put more supportive programs in place. And of course, my research. And so partnering with a lot of faith communities and hearing from caregivers and seeing what other new programs we need to do, but also allowing the caregivers in this community an opportunity to participate in my existing research that we have going on. So I have a lot of caregiver psychoeducation programs that I already had in place with my colleagues, and it's caring for someone during a crisis, learning how to navigate the healthcare system. Also, Caregiving While Black is another signature program because it's acknowledging that a person's culture or the color of their skin adds an additional layer of challenges when you're caring for someone living with dementia and trying to navigate the system. And so really bringing these opportunities to the San Antonio area, and hopefully we can have better outcomes. That's what I'm about. I want to have better health outcomes for our caregivers, those living with dementia, and I want to empower our community so they can speak up. And so when they interact with the healthcare system and programs in the community, that they can speak up and say, this is what we need, and not be turned away and going home without hope or support.
Well, I'm really very excited to see, as I said before, I'm so happy that you chose to join us. I'm really looking forward to seeing what you do and how it impacts South Texas. As you know, Bill Henrich, who recently passed, this was one of the visions that he had for South Texas, was to bring high quality Alzheimer's care and care for dementia and other neurodegenerative diseases. So it's a pleasure to have you here. I was hoping, I'm going to shift a little, and I was wondering, Maple Goldsmith, if you might be able to join us so we can talk about caring for the caregiver with you, a person in the program who's there. So if we could welcome to the stage. Hello. So Dr. Delgado, maybe you could tell us from your perspective what caring for the caregiver is, and then I'm interested from you to hear what you think caring for the caregiver is, because it might be similar, it might be a little different.
Sure, absolutely. So the Caring for the Caregiver program is a mission-driven multi-service program. And we offer education, we also have research that we can create evidence-based programs to attend to the needs of caregivers. So skills building, we create communities. So one of the big pillars of the Caring for the Caregiver program is ensure that the caregivers are recognized, that they're assisted, that they're integrated, that they're engaged, and that we can be that hub and that conduit for them to develop the skills that they need to be able to be a better caregiver in that sense. At the same time, they care for themselves. And in the same platform, then we try to bring community together. Why? Because in caregiving, there's a lot of isolation And loss is a big part of caregiving. And when there's loss, there's a profound effect in not only the individual, but the family as a whole, as a unit. So we try to be that hub for the caregivers where they can increase their education at the same time that they can create community, and that we can also support the researchers that are doing great work like Dr. Epps, so they are able to continue to do the work and create evidence-based programs.
So for you, I would be interested a little bit in your story, and I would just really appreciate your willingness to do this. It's so helpful to hear. You were talking about community engagement and hearing from your experience. So what is your experience of caring for the caregiver for you?
First of all, thank you for having me. Can you hear me okay?
Yes.
Awesome. My journey started 3 years ago, and one thing that I can say about caring for the caregivers is I'm not alone. I felt very isolated. I retired 3 years ago, and what did I find? I ended up in a new world, completely a new world, where role reversal. My husband used to take care of all the finances. That was on me now. I was in the workforce for 46 years, interacted with people day in and day out, customers and associates and everything, and then suddenly it's just me and him at home and dealing with 9 falls in 1 year. He had one fall that he had a brain bleed and mood swings, and suddenly he wasn't the same man that I married. And so luckily he had a neurologist at UT who was taking care of his restless leg syndrome. Well, I finally got to go to one of his appointments and explain to her, there's hallucinations going on. There's falls, 9 falls in the 6 months that I've been home, and something's not right. And luckily, they saw the signs that were going on there and let me go to a brain specialist. And while they were doing the cognitive testing, they had me in a room hearing my story and what I was going through in this short period of time. 2 hours into the testing, they decided, yes, he has cognitive impairment. He has some form of dementia. We don't know what. But in that short period of time, in the 2 hours, they were saying, hey, this is a guide for you, a resource. The resources were just, they helped me through where I am today. And right away, I had a social worker set up, Angela. They gave me said, you're going to need a therapist. You're going to need a counselor. That was lined up for me as well. Then they said, we also have other events and outreach programs that you can go to. I jumped on that right away. Thank God I did. And so with that, I was able to speak to my counselor, and she introduced me to GROW, which was occupational therapy for dementia-related friendly gardening over at the Botanical Gardens. My husband loved to garden. That's all he loved to do, and so did I. And so that was just right up our alley. We went out there, and we've been going there for 2 years. And with that, I've joined a community of fellow caregivers who are going through the same thing that I'm going through, whether it's Alzheimer's, frontal lobe, Lewy body, which my husband has, and we're all as one now. And we miss each other when we don't have a session. We have a break between December and January. We're looking for each other, giving hugs in the fall. And that was a good, now I actually have volunteered on my own for the Botanical Gardens. I'm a gardener there, and I sell plants, and I'm a docent. I give tours, and that has brought so much joy, and it helped fill the gap that I had just being me and him and being away from people. So that has been very refreshing for me. I think in that one instance, I've become a better caregiver because I'm more patient with him. There's so many things that I've learned. We go to an art museum, San Antonio Museum of Art, quarterly, and we get to tour paintings, and we have the whole lobby is set up just for caregivers and for their loved ones. We see a couple of paintings, we make our own interpretation of them, we go back down, they give us lunch, they provide lunch for us, and we also do our own interpretation of whatever we've covered. That's another outlet that is good for our patient, our loved ones, and for us too, because it's interaction, it's getting involved. We have life after being closed up in the home, and isolation, you said it, it's the worst thing that can happen. That is that's the end. You need to be engaged. The doctors even told us we needed to be engaged.
So I'm curious, you mentioned, and obviously you have other support in your life. I know your daughter's here tonight. What's different about that connection to other caregivers in the way? How is that different than the support you receive? Because I'm sure both are valuable, but I suspect they're different.
Yes, they are. I can tell you, as a caregiver, speaking to another caregiver, it is totally different. We understand what it is. Every day is different. You never know what you're going to wake up. You know you made it through yesterday, but what's going to bring today? And through the caregivers, we've been exposed to different workshops. Every month there's a different workshop that has helped us. Friday we're going to one to sleeping challenges. My husband doesn't sleep all night, but he'll sleep in the morning and all day. How do you live around that? You know, I can't make all the appointments after 2 o'clock in the afternoon. You know, it doesn't work. So we have the same challenges, and we understand each other. And it's how would you say, non-judgmental. You know, if my husband can't get up out of a chair, Tom is one of my fellow caregivers, compadres, I'll say, will be there to help my husband get up. We understand if you know, they repeat, or if it's okay if they can't get up. It's okay if they don't water the plants right. It's okay if they color out of the line. They're doing their own thing. We're in their world now, and I've learned that in this past 3 years. And my husband, I've learned patience. You have to have patience. It's not their fault. They're not doing this stuff on purpose. I've learned that. I used to get so upset with my husband, he'd spill his medicine or whatever. It's just he didn't have feelings in his fingers anymore. I've learned that through y'all. You know, the doctors can tell you so much, but it's the common, you know, how did your day go? Or how's he doing? And, oh, you know, he's having trouble with this. Well, you know what? This worked for me. And in our support group, we have a support group as well. It started out with 3 families. It's now 12. And it's word of mouth that's getting out there. And it's so refreshing to know that we're not alone and we're here to help each other and we help solve each other's problems. Mm-hmm. You hit on it right away when you said about cultural differences. Mm-hmm. I'm Hispanic, and you know, there are some things you didn't talk about. You know, you just keep it, you know, you make the sign of the cross and hope everything went well. You know, and have faith, you know, because Almighty God is there for us. But, you know, you just don't talk about that kind of stuff, not at the dinner table. My husband is not Hispanic, but he's had diabetes 48 years since he was 17 years old. He kept that hidden. He didn't want to talk about it. We didn't talk about that stuff. So for us to bring it out on the table and talk to our children about, hey, we're facing this, we're going to need your help. Some of them understood, some didn't. You know, I think it's wishful thinking that they're not going through that anymore. But again, I've become a better caregiver. I've learned, what is the latest thing we did? We did literacy, digital literacy, for those that don't know how to use a computer. I know the computer, I had to do it at work and all, but to go out there and see the community that we reached out to, Dr. Delgado can talk about that and how, and I even asked her, I asked Veronica, Veronica, how did you come up with this? I've learned, you know, how to read this is a scam, you know. I was ready to pay the $700 until she told me, you know, this is what you look for and all that, and it happened again, and I knew what to do. So I felt like, I know how to work the computer now, you know, but and I asked her what happened, and she said so many patients, loved ones, weren't making it to their office visits because they didn't know how to use MyChart. They didn't know how to read the messages that were being sent to them. So now what are we doing? We have literacy classes for caregivers. And again, non-judgmental because we're all over 55. And so far, no, there were some young ones there. The daughter was there too. And we have a new community where now when I see them, because I've gone to another class, it's, you know, the hugs and the friendship and the camaraderie, and it's just amazing. And I'm a better mother, I think, and just a better person and all, and it's making his life better too.
Well, I so appreciate your sharing it. I'm sure all of us get our health care only at UT Health San Antonio. But if you did not know MyChart, and you all have experienced this regardless of where you choose to do that, is the electronic health record and these interfaces And I remember my mom calling me to tell me my son was in jail, and I just was crying out. My mom has dementia. Mom, don't give them money, for the same reason, because you don't know, and it's very striking. I thank you so much. I hope you will stay up here. We're going to take some time to ask questions, and I think it would be great if you could join us with that.
Thank you.
I'm just so curious. I think thank you to both of you for what you've presented. I'm
Thank
sure
you
it's
so
raised a
much.
lot of questions. I know at work I'm going to be sending you some emails about some questions I have or people that I'm interested in. But thank you so much. And if we could just give them a round of applause before questions. So we have some microphones I see in the audience, and I'd love to hear your questions, and you can ask these brilliant people what they do or what their thoughts are.
Well, money is always a problem in healthcare. And so to provide for these kinds of programs, sometimes you might need to convince insurance companies and so forth that it's valuable to have these kind of programs. Do you have any data that says that these programs actually reduce healthcare costs for the patient, for the person who's being cared for? Because it should, I would think. But do you have any data on that?
So we know from AARP, the national data is that caregivers save the government $600 billion a year. We at the program, we are not tracking, in that sense, that data. But by, when you look at that philosophical underpinnings of what the caring for the caregiver is and what are the different unmet needs that we are, providing for these caregivers, we can confidently say that caregivers are more equipped to be able to do the work, right? Their duties and tasks. And like Mabel very nicely said, we are able to keep them emotionally sound and strong to be able to face the next day and the next day. And for us, the mission is improving their quality of life and making sure that they have access to care and that they are equipped to be able to do the work they need to do in a daily basis, because they have to do it anyways. So if we're not there, then they're going to be missing that piece.
Can I add something?
Yeah, sure.
When I started my journey, and this is just me, but I don't know if everybody knows what an A1C is when you're diabetic. Mine was 11. And since doing more exercise, being more going outdoor and doing my thing outdoors and stuff, I'm down to a 6.4. So my doctor's happy, I'm happy, and my husband's happy because I'm there now. I'm not, in stress.
That's a great point. Thank you.
And
Other
so,
questions?
I wonder, do you want to share that research that we're brainstorming on to at least measure? We're putting it in a grant in the beginning of the year to see how one of our education programs may be able to decrease ER visits amongst our caregivers and those living with dementia. So that is our first step to see if we can capture something and then be able to translate it into any dollars. But really, this is something, and I'm glad you brought up that question. We're just so focused on making the lives of the caregivers better. We never think about going that next step and seeing how does it impact the healthcare overall, the system. And so we are looking at that at the top of the year to submit so we can try to capture some of that data.
It's a great example, too, of how you're maturing the field in the science of caregiving
Yes.
and starting to bring it into focus and really garner those resources by providing those demonstrations. What a great question.
Yeah.
Thank you. I see another question over here.
Yes, in terms of healthcare innovation and trying to get from research to reality, one of the things that hasn't been addressed enough is my concern is like from here, from San Antonio all the way to the border and the rural areas, how are you going to reach the rural areas? There's some programs going on right now. I think it's run by, it starts with an M program, I can't remember, by Texas A&M extension program. Are you part of that, or are you extending out to them to get these new ideas out to the rural areas in terms of healthcare?
How are you, if you're not involved with Text Name, how are you addressing rural as part of this? That's a great question as
So
well.
we are not involved with that program, but we have a number of faculty members that are very well known in the south border of the Texas border. And one of the things that we're doing with Dr. Wright, and he's somewhere, in the public here, is that the School of Nursing has a mobile unit, a health mobile unit. And we deployed the mobile unit 2 months ago in July or so to Kerrville. And we were able to do free screenings for healthcare and all that there. And then the next step will be going the next quarter to the South Texas. So we're gonna be able to do free screenings for not only veterans and non-veterans, but also the caregivers, which sometimes we know from the literature, 40% of caregivers don't have health insurance. So those are some of the ways that we're gonna be going into those regions. But we have a number of faculty members that are actively working, like Dr. Cantu out of the School of Nursing, and they're very well known in those regions because of their work with vaccinations, with diabetes, with prevention, and nursing science. So I don't know if
I might add to that at UT Health, we have a program in Laredo with our Alzheimer's Institute where we actually send down physicians. It's an area of the state that doesn't have access to the type of neurological care that we may have in San Antonio. And so there's a clinic going on there. It's also important because you mentioned the disparities with different racial and ethnic groups having higher levels of dementia. And so being in Laredo, being able to provide that as access there. We typically access also through the area health education centers, which are similarly based throughout the state. And Dr. Jenna Lesser, also, there's a theme tonight, by the way. You might understand nursing as a caregiver-centric profession. She actually works quite a bit with programs throughout the state in that way as well. Other thoughts from you on that?
Now, I want to say that with me being new to the area, rural caregivers, that I do have my eye on those and those families that are in the rural area. And what I've done in the past is I have taken some of the research programs that we've developed and showed improvement for caregivers, and then partnering with the agency. So in Georgia, we partner with the Rosalind Carter Institute for Caregivers. And what I did is I actually trained people in the community to deliver the programs in their respective communities. So we can travel and be there, but actually someone in the community, and it's very similar to like a community health worker, but they are really trained specifically to deliver the program that we had developed and tested.
And I'm glad you're mentioning that because that actually is an extension of what Mabel was saying with the digital literacy. We reach out to the south, the border, and they don't have that program there. And AARP Texas is partnering with us to be able to bring it through Senior Planet to that area. So that is a train the trainer program where we have to train those who are in the community to be able to deliver the digital literacy in those regions. So
Thank you. I think there's another.
Yes, ma'am.
Oh, hi.
I was wondering, what theoretical frameworks do you generally use when you're designing your studies?
So go ahead.
Well, I have
Yeah.
two, right? And so one of the theories that I use is the social cognitive theory. I use that for many of my psychoeducation programs, but then also for my community work, I developed a theory. I kind of merged them together, and it's called the Dementia Community Adaptation Model.
And what is that? In 60 seconds or less, or I'm going to
What
ask
is
you
that?
to define social cognitive theory.
Oh,
I'm
yeah,
just
let me
teasing.
I'm gonna do this one. But what I found was when we were going, many times in the community, we're expecting families to adapt to us, adapt to the business or whatever is going on. But here is reversing, me asking the families, that businesses and organizations, you need to adapt to the families. And it's showing that it will reduce these family stressors. And so that's kind of summed that up.
So just while you're doing that, for the audience who doesn't, I love your question about theoretical framework. Just walk us through just briefly, why is a theoretical framework informing research? Why is that important?
I believe, you want to answer or you want me to?
Yeah, whatever.
We're going to get to your theory. in a
Oh,
second.
okay, all right. So it's really important. So the thing is that we have a basis of why this should work. It's just not you saying, oh, I think I have this great idea and it should work. No, it's actually theory that has been tested, and you are able to connect your concepts to pieces of the theory to say, okay, this is why it should work. And then the whole part of research is testing it to see, okay, now we're in this new environment, or now we're looking at this new variable, and let's see if this theory still works.
Yeah, a lot of people call it now, you may have heard it as an evidence-based practice. UT Health delivers evidence-based care. These are treatments or interventions or practices that work, and informing them with theory. Okay.
And in epidemiology, what I do is I use a social ecological model and then also biopsychosocial model. And basically, epidemiologists, what we are very interested is to see how a disease or illness behaves in the community and how it gets distributed. So we're very focused on prevention programming, but to be able to have a prevention program, we need to know where it stems from, right? What is associated to or correlated. So when it comes to the military and veteran caregivers, we started from that, perspective of looking at their whole health and well-being from a biopsychosocial model, and we started using validated metrics to be able to measure how their health and well-being was being, compared to the rest of the nation. So we can then have those results that said, okay, so military and veteran caregivers may need a bit of different approach than the typical caregiving community or caregiver community. So that's basically what, and then we're looking very much at the trajectory of health. So we're following up caregivers and also the veterans. So how we're doing is because of the beauty of being affiliated to the VA, we have data, we'll be able to invite the veterans to be part of the work. And then as an extension, we invite also the caregivers. That's how we've been able to identify them and also partner with national organizations that they have a niche and they have those networks of caregivers. But social ecological model is usually in biopsychosocial models.
Thanks. I think we have time for one last question.
As a caregiver, how do I tap into the resources that I'm hearing UT Health and Mabel talk about?
utcaregivers.org. You can go online to utcaregivers.org. We also have I don't know it by heart, the phone number. We just have a new phone number, but when you call, you can make sure that someone is going to be at the end of the line. Her name is Veronica Martinez, and she's fully bilingual, which is a beauty. Another thing that I want to say about the Caring for the Caregiver, everyone that is in the program has had the experience of being a caregiver. So we're all in this in hearts, and people can reach out to us either through the website. We have a form that they can complete, or through an email, or through the phone number. So any of those are fully described or displayed in the website, and people, that's how they come to us. The other thing too is that, and I didn't mention this but we have a network. We cannot do this by ourselves. Definitely we cannot do this by ourselves. So we have a network. We're part of the ACOG caregiving community, and there in the Bexar County, we work very much with them. They refer caregivers directly to us, so by the time they get to us, we know they have been vetted. Some of the needs have been identified, and then we're the connectors. We also work with the Alzheimer's Association, with the Botanical Garden. I mean, we have a network of over 50 different organizations locally that are extending their doors and bringing us to their doors.
So that's utcaregivers.org, and the number, because of Anna Maria
yes,
Rapetti.
thank you.
And I think we could probably send this out to the people who attended. Okay, so we can send this out, so you don't need to be writing this down, but it's 210-567-5831. But we can have that sent, I'm sure, just to everybody so that they have it on hand.
And the reason we changed the number is because the number, I remember when I first came as a director, I called the number. And the number had, for this, press 1. For this, press 2. Oh. And I got frustrated. And I said, oh, no. So this number goes directly to Veronica.
That's great.
Well,
Yeah.
Well, I just want to thank you both again. Special thank you to you, Mrs. Goldsmith. I really appreciate your time. We all do. And thank you for telling your story. And to the two of you, Dr. Epps, Dr. Delgado. Thank you so much. And thank you both for coming and listening and being interested and curious. It makes our lives better when we seek inquiry and understanding. This was a great presentation. So thank you so much.
Thank you.